Hi, my name's Erin. I'm a speech and language therapist working for Gloucestershire Health and Care Services, and this short video is to tell you a little bit about how our new virtual drop-in service is running, so you know exactly what to expect in the session. The virtual drop-in sessions are a short video call with you, your child, and a speech and language therapist. The sessions are for children who are not yet attending school, where there might be concerns around their speech and language. It might be concerns that you have, your child's nursery or preschool has, or you might have been directed to us by your health visitor. Our virtual waiting rooms work on all devices, so that could be smartphones, laptops, tablets or desktops, as long as they've got a front-facing camera and a microphone. You must have Google Chrome or Safari installed as the internet browser for it to work properly. We tend to recommend using the biggest device just in case we do decide to show you some pictures so you can see them really well. It also might be useful to use a tablet in a case or a laptop if you've got one, just so you don't have to hold it during the call. If you've got any concerns about not being able to access the video calls and not having access to a device, give our main office a call on 0300 421 8937 and somebody should be able to help you. All of the details about how to request a virtual drop-in slot are on our website. Once you've requested a slot, someone from our team will be in touch to confirm a date and time and provide you with all of the details that you need to log into the virtual waiting room. It's really important that if you can't make the call for any reason that you let us know so we can offer that slot out to another family. The drop-in slot that you're offered will last no more than 15 minutes, and during this time we hope to find out a little bit about your child and spend some time seeing how they communicate. To begin with, we'll ask you a little bit about what your concerns are. We'll ask you about your child's speech and language development and about their other skills. We might need to know some medical history and things like hearing checks. We'll probably also ask you about what other professionals might be involved in helping your child so we can make sure that we talk to them too. After this, we'll ask you about any strategies you might have already tried to help with your child's talking, and we'll have a chat about what further help you might want from us. This will usually last around 5 minutes. It will be helpful to think beforehand about how your child communicates. Do they use words, phrases or sentences, or do they use other ways of letting you know what they want by pointing, taking you to things or using gesture or sign? Have a think about how clear your child is talking. Do they muddle some sounds up sometimes or miss sounds out of their words? Do you understand everything that they say to you, or do you find it difficult? We will also talk to you about how well your child can follow instructions. Have a think about the sorts of instructions your child might be able to follow. Can they do the daily routine instructions like time for dinner, go and get your coat, put your shoes on? And what about instructions in play such as give an apple to baby or where's Teddy's nose? Have a think over the next few days about whether your child can do this without any help from you, or do they need you to point or show them these instructions? You might find it useful to write some of these things down ready to tell us at the drop-in so you remember all of the information. After we have had this chat with you, we'll want to spend a few minutes watching you play with your child to see how they communicate. We may also ask your child to have a look at some pictures on the screen depending on their age and what their needs are. We would find it really useful if you can find a quiet space in your house, away from other people and distractions like the TV, so we can make the most of the time we have with you. Make sure the light's on so we can see you, because that's really important. It can be really helpful to have some toys or activities out ready that you know your child likes to play with, so they're quite happy to play during the session. And don't forget to make sure your phone or your laptop is charged before you use it. It might be useful to find somewhere that you can prop up a phone or a tablet if you don't have a stand for it. Before we go, we'll give you an opportunity to ask any questions you might have. We'll also have a chat with you to give you some advice based on what we've seen so you know what to carry on with at home, and then we'll talk about what the best next steps might be. Following this, you'll get a letter or an email to confirm all of this. Please remember, the person in the session with the child must be an adult that has legal parental responsibility for the child. Unfortunately, we can't do sessions with other family members or staff at the nursery or preschool. As this is a new way of working for us, after the call we will ask you to complete a short survey based on your experience of the drop-in. This means that we can make any changes that we need to for families in the future. We look forward to seeing you soon. Please remember, the session lasts no more than 15 minutes. Don't forget to charge your device and make sure you've got somewhere to prop it so you don't have to hold it. Find a quiet space for the appointment and make sure the room is well lit. Have some toys out ready for your child to play with, and have a think before the session about what you want to ask us and talk to us about. The adult in this session must have legal parental responsibility, and if you have any problems at all, please call the office on 0300 421 8937.